The Ebola outbreak in Africa continues to spread and fears are rising that it may cross continents. Brazilian health authorities are monitoring 2 patients for possible Ebola infection in Sao Paulo and Rio de Janeiro. Meanwhile, the WHO Director General Tedros Ghebreyesus visited a newly opened Ebola treatment facility in the city of Bunia, located in the eastern part of the Democratic Republic of Congo.
So because of many factors, the virus was circulating undetected. So we have number of cases which is much higher than previous outbreaks before even it was detected. So that makes it complex. But not only that, there is displacement, there is conflict in this area that makes it complex. So I think the response we do should be strong enough to catch up and stop the outbreak.
Earlier, Ghebreyesus visited the eastern province of Ituri, which is worst hit by a severe outbreak and is gripped by highly contagious hemorrhagic fever. Upon his arrival, the United Nations health chief hailed the resilience of the African country for overcoming past outbreaks of the disease.
As we know, DRC has faced Ebola before, 16 times. And has ended every outbreak, and this is the 17th. That history gives me real confidence.
The Centers for Disease Control and Prevention has confirmed over 1,100 suspected cases of Ebola in the DRC and 246 deaths. State services are largely lacking in Ituri province, where access is hindered by insecurity due to the presence of armed groups and militias. At the same time, neighboring Uganda has confirmed 9 infections, including 1 death, as it closed the border with the DRC this week and ordered a 21-day quarantine for anyone arriving from that country. No vaccine or specific treatment exists for the Bunia strain of Ebola, which is behind the current outbreak. The medical charity Doctors Without Borders says that there has never been an outbreak which recorded these many cases in the first days after it being declared. However, CDC Africa has assured that a vaccine should be ready by the end of the year. Ebola, which spreads through close contact and bodily fluids, has killed more than 15,000 people in Africa over the past 50 years. The deadliest outbreak in the Democratic Republic of Congo claimed nearly 2,300 lives out of 3,500 cases between 2018 and 2020.